"You don't belong in this hospital, and you never did," Chief of Medicine Dr. Raymond Hollister said, his voice low and deliberate, the kind of low that wasn't quiet at all. It was a warning wrapped in institutional authority. He didn't look up from the termination paperwork when he said it. He just slid the folder across his mahogany desk toward nurse practitioner Davia Monroe and waited for her to break. She didn't. What Dr. Hollister didn't know, what no one inside St. Aurelius Medical Center in Baltimore knew, except for a single encrypted file locked on a federal server in Washington, was that Davia Monroe wasn't just a nurse practitioner with 12 years of spotless clinical service. She was Senior Investigator Davia Monroe of the Department of Health and Human Services, Office of Inspector General, 18 months into the most complex healthcare fraud investigation her division had ever run. And the man sitting across from her, studying his own fingernails with practiced indifference, was the centerpiece of every single warrant waiting to be signed. She had made him do this. She had planted the thread, pulled it just enough, and watched him unravel toward her. Dr. Raymond Hollister had built St. Aurelius into something that looked, from the outside, exactly like a triumph. A Level 2 trauma center anchored in West Baltimore, serving a predominantly black and low-income community that had been medically underserved for decades. He gave speeches at hospital galas about equity and access. He had a profile in Johns Hopkins magazine. The mayor had called him a pillar of the community at a ribbon-cutting 2 years prior, and Hollister had worn that phrase like a second white coat. Behind the administration wing's frosted glass doors, the picture was considerably different. For 7 years, St. Aurelius had been running a ghost billing operation of stunning audacity. Patients who came in for routine procedures, knee injections, wound care, minor cardiac monitoring, were being billed to Medicaid and Medicare for surgeries that never happened. Patients with dementia, patients who couldn't read their discharge summaries, patients who trusted the hospital because it was the only one that would take them. They were the raw material. Hollister's network ran from the billing department to 2 complicit physicians and to a regional insurance broker named Warren Fitch, who processed the fraudulent reimbursements through 3 layers of shell corporations registered in Delaware. The federal government had been losing, conservatively, $4 million a year for 7 consecutive years. The OIG had caught a thread 18 months ago, an anomaly in a Medicaid audit, a billing code appearing at statistically impossible rates for a facility St. Aurelius's size. Davia had taken the case because she had spent 6 years as an actual floor nurse before her law degree and her federal appointment, and her division chief had told her, simply, "We need someone who can read a chart and a ledger in the same afternoon." She had built the cover identity meticulously. Real nursing credentials. Hers were genuine. A fabricated employment history routed through a staffing agency that her division quietly controlled. Letters of recommendation from physicians who existed only on paper. She had been inside St. Aurelius for 18 months, taking overnight shifts in the cardiac step-down unit, earning the trust of every charge nurse on the floor, documenting everything. And then, 6 weeks ago, she had made a calculated move. She had flagged 3 billing discrepancies internally, not to expose them, but to see who would respond, and how fast. She had submitted the concerns through the hospital's ethics hotline, deliberately using language specific enough to reveal that someone inside the building understood exactly what the billing codes meant. Within 48 hours, Dr. Hollister had transferred her to the night float pool, a bureaucratic purgatory where nurses were bounced between departments with no continuity of patients, no ability to build relationships, no access to the administrative systems she had been quietly mapping. A week after that, she was placed on a performance improvement plan, the first in her 12-year career, citing dummication deficiencies that her supervisor, when pressed privately, admitted she had never personally observed. Davia had watched it all and felt something that wasn't quite anger and wasn't quite satisfaction. It was closer to recognition. She had seen this mechanism before, not in hospitals, but in the files of every institution she had ever investigated. It was what corrupt systems did. When they sensed a threat they couldn't identify, they didn't eliminate the threat, they just moved it somewhere they could watch it. Hollister had moved her, but he hadn't neutralized her. He had simply shown her, with crystalline clarity, exactly how much he knew about what she had found. Now she sat across from him in his office, on a Thursday afternoon in March, listening to him deliver a termination that he had clearly rehearsed. "Your performance over the past 2 months has been below the standard we expect at this institution," Hollister said, finally looking up. He had the particular confidence of a man who had never been seriously challenged in a professional setting, the kind of confidence that reads as calm but is actually just the absence of fear. He had never had reason to be afraid. "I want to be clear that this is a personnel matter, and nothing more. I'd encourage you not to make it something it isn't." That last sentence was the tell. Davia had been an investigator long enough to know that innocent men conducting routine terminations didn't feel the need to preemptively define the boundaries of what they were doing. "I understand," she said. She kept her voice exactly where she needed it. Tired, a little resigned, the sound of someone who had fought and lost. She had practiced this in the mirror, not because she was a performer, but because authenticity under pressure required rehearsal, and she had never met a target who wasn't watching for a crack. She signed the separation agreement. She gathered her personal items from her locker, a photograph, a phone charger, a coffee mug with a small chip on the rim she had always meant to throw away. She walked through the lobby past the security desk, past the murals of black children, painted on the wall by a local artist that Hollister had commissioned for the ribbon cutting, past the automatic doors and into the cold grey Baltimore afternoon. She sat in her car for exactly 4 minutes. Then she called her division chief. "He took the bait," she said. "He terminated me this afternoon. Paper trail is complete. He put it in writing." "Good," said the voice on the other end. "The warrants came through an hour ago. Judge cleared everything. Billing records, server access, the Fitch correspondence. We're ready to move," Davia said. There was a brief pause. "Monroe. He's holding a board presentation next Friday. The quarterly review for the hospital's community health metrics. He's going to present in front of the full board of directors, the hospital's major donors, 2 city council members, and local press. He's been planning it for weeks. It's his moment." Another pause, longer this time. "You want to do it there?" "I want him to build the biggest audience he can find," Davia said quietly, watching a pigeon land on the hood of the car in front of her and immediately leave again. "And then I want to walk into that room." She had 1 week. She spent the first 3 days in a federal field office on Pratt Street, working with forensic accountants to assemble the evidentiary package into a form that could be presented in under 90 seconds. She had learned early in her career that the moment of reveal in a complex fraud case was not actually about evidence. The evidence had been gathered, the case was already built. The moment of reveal was theatre, and theatre had to be lean. She spent the 4th day meeting with Warren Fitch's attorney. Fitch had been picked up quietly on the Wednesday after her termination, a civil knock at his office door, 2 agents, no drama. He had lasted approximately 6 hours before his attorney began negotiating. By Thursday morning, Fitch had provided a signed statement confirming the routing structure of the shell corporations, the timeline of Hollister's personal sign-offs on the fraudulent billing batches, and the existence of a secondary account at a credit union in Towson, where Hollister received his quarterly disbursements. The statement was 31 pages and included 2 years of email correspondence that Fitch had saved, apparently, as personal insurance. People who ran fraud schemes alongside Raymond Hollister, Davia had observed, did not entirely trust Raymond Hollister. She spent Friday and Saturday reviewing the hospital's bylaws to confirm what she already knew, that the quarterly board presentation was open to credentialed former staff members who had outstanding HR appeals pending. Her appeal had been filed the morning after her termination, pro forma, through proper channels. It was not going to succeed. It didn't need to. Sunday she spent on the phone with her mother in Cincinnati, who did not know what her daughter did for a living in any specific sense, and had long ago made peace with that gap. They talked for 2 hours about her nephew's Little League season and a recipe for sweet potato pie that had been in the family since before either of them could remember, and Davia sat on the floor of her apartment with her back against the couch and let the conversation be exactly what it was. Monday, Tuesday. Final briefings. The tactical team lead, a compact, serious agent named Reyes, who wore the same expression whether he was eating a sandwich or breaching a building, walked her through the entry and containment sequence twice. 2 agents would be positioned outside the auditorium's main doors, 2 more in the corridor behind the dais. Jenkins, her second, a former Chicago PD detective, who had made the jump to federal service 5 years ago, would be in the room, sitting in the back row, dressed as a freelance journalist, covering the hospital's community health initiative. She had a press credential. It was real. "You sure you don't want to just let us handle the entry?" Reyes asked her on Tuesday afternoon, not for the first time. "I'm sure," Davia said, "because from a tactical standpoint." "I know what it looks like from a tactical standpoint," she said. "I've been inside that building for 18 months. I've watched him fire people, demote people, intimidate people who had done nothing wrong. I watched him use that hospital, that community hospital that those families depend on, as a personal revenue stream. I'm going to be in that room." Reyes looked at her for a moment. "Understood," he said, and didn't raise it again. Friday arrived the way important days always did, unremarkably, through an ordinary alarm and ordinary light through ordinary blinds. Davia dressed carefully, not in scrubs, a dark charcoal blazer over a white shirt, pressed slacks, shoes she could move in, her federal credentials in her inside jacket pocket, her badge on a lanyard she would keep hidden until it wasn't. The quarterly board presentation for St. Aurelius Medical Center was held in the Founders Auditorium on the 3rd floor, a room with burgundy upholstered seats and a dais at the front that Hollister had personally approved in a renovation 2 years prior. It held about 120 people. When Davia arrived, 14 minutes before the scheduled start time, it was nearly full. She recognized the board chair from the hospital's website. She recognized 2 of the city council members from Baltimore news coverage she had reviewed during the investigation. She saw 2 cameras positioned at the side walls, local news. She saw the journalists with their recorders and their open laptops. She took a seat in the 5th row, on the aisle, and she folded her hands in her lap, and she waited. Hollister entered from the side door, to the left of the dais, accompanied by his deputy administrator and the hospital's chief legal officer. He wore a dark suit and a tie the color of a surgical scrub. He looked exactly like what he presented himself as, composed, authoritative, and genuinely comfortable in front of an audience. He had done this many times. He did not see her immediately. Then he did. The beat of recognition was brief, a slight constriction around his eyes, the kind of micro-expression that most people would miss entirely. Then, it was gone, replaced by the same polished calm. He sat down at the table on the dais and accepted a glass of water from an aide, and he began. He was, she had to admit, very good at this. He spoke for 22 minutes about the hospital's expanded reach in West Baltimore, about new partnerships with community health workers, about declining readmission rates and improved patient satisfaction scores. He had slides. The numbers were real, or at least, most of them were, and he delivered them with the practiced warmth of someone who had learned that sincerity, deployed correctly, was just a more sophisticated form of pressure. The board chair thanked him. The council members nodded. One of the journalists typed something. "Are there any questions from the floor before we move to the financial summary?" The board chair asked. Davia stood up. The room shifted the way rooms shift when something unexpected happens, a collective, subtle realignment of attention. She could see Hollister's hands flat on the table. They didn't move. "My name is Davia Monroe," she said, and her voice was steady and clear and carried to the back of the room without effort. "I was employed at this hospital as a nurse practitioner for 18 months. I was terminated 10 days ago by Dr. Hollister for raising internal concerns about billing practices. Davias. Ms. Monroe," the board chair said carefully. "This isn't the appropriate forum. I have a pending HR appeal, which entitles me to address this body under Section 12 of the hospital's own bylaws," she said. "I would like 30 seconds. There was a moment of consultative murmuring among the board members. The chief legal officer was already leaning toward Hollister, whose expression had gone very still. 30 seconds, the board chair said. Davia reached into her jacket pocket and removed her credentials. Not the hospital's ID, the federal one. She held it up so that the front row could read it clearly, then turned it slowly so the cameras on the side walls could find it. "I am Senior Investigator Davia Monroe of the Department of Health and Human Services, Office of Inspector General. I have been operating undercover at this hospital since September of last year as part of a federal fraud investigation. Dr. Raymond Hollister." She paused, just for a second, and looked directly at him. "This institution has been systematically billing Medicare and Medicaid for procedures that were never performed, at an estimated loss to federal health programs of $28 million over 7 years. I have documentation, corroborating witness statements and financial records. We also have a signed cooperation agreement from Warren Fitch. The last sentence was the one that landed. She watched it happen on Hollister's face, not the press, not the board, not the council members. She watched it happen on him, the specific and unmistakable expression of a man who understood, in a single instant, that the walls of the room he was standing in were not walls at all. The auditorium erupted. Journalists were on their feet. Board members were speaking over each other. One of the council members had gone pale. The chief legal officer stood up so fast his chair rolled back and struck the wall behind him. Hollister stood up too, and for a moment it looked like he was going to say something. His mouth opened, and he had the bearing of a man reaching for a script that had always been there before. But the script wasn't there anymore. The main doors opened. Agent Reyes and his team came through with the efficiency of people who had done this before, which they had. Jenkins appeared from the back row, badge visible, already moving down the aisle. The secondary entry behind the dais opened simultaneously, 2 more agents stepping through, positioning themselves at the corners of the stage. "Dr. Hollister," Jenkins said, reaching the dais, "please step away from the table. I want my attorney." Hollister said. His voice had changed. The warmth was gone, and under it, where the warmth had been, was nothing particularly remarkable, just a man who had run out of room. "You'll have access to counsel," Jenkins said. "Step away from the table, please." He did. He stepped away from the table that had his name on a placard, in the room he had renovated, in the hospital he had used, and he was walked around the edge of the dais and down the side aisle toward the door, while 120 people watched, and 2 cameras recorded, and nobody said a word. Davia didn't move from where she was standing. She watched him pass through the door, and then the door closed, and the room stayed quiet for another 2 or 3 seconds. The kind of quiet that isn't really quiet, just the pause between one thing ending and the next thing beginning. Jenkins came back to where she was standing. "Fitch's cooperation just got upgraded," Jenkins said quietly, handing her a phone with a message on the screen. "He's given us 2 more physicians and the billing director. We're executing those warrants in the next 2 hours. The Towson account is already frozen, just over $2 million in it. Total asset freeze across all associated entities is closer to $31 million. "Good," Davia said. "Reyes wants to know if you want to ride back to the field office." "I'll drive myself," she said. She picked up her bag. She walked out through the main doors of the Founders Auditorium, past the journalists who were already calling their desks, past the board members standing in clusters in the hallway, past the mural in the lobby of black children, painted bright against a blue background, past the security desk where she had badged in and badged out hundreds of times, with a credential that was real, and an identity that was not. She walked through the automatic doors and into the March air, which was colder than she had expected, and smelled like rain coming from somewhere off the bay. She had spent 18 months inside a building that was supposed to serve people who had nowhere else to go, watching those same people's trust get converted into line items on a fraudulent billing ledger. She had eaten lunch in a break room with nurses who worked double shifts and took home thin paychecks, and genuinely believed they were doing good work inside a good institution. Some of them were going to have complicated feelings about all of this, and she had already thought about that. And she didn't know an answer that made it simple. Corruption never announced itself. It didn't wear a sign. It wore a pressed suit and a warm handshake and a speech about community, and it sat in the nicest chair in the room and waited for everyone around it to decide that the cost of looking closely was too high. Davia Monroe unlocked her car, sat down in the driver's seat, and took a breath. The case would take another 8 months to prosecute, fully. There would be depositions and motions, and one ill-advised attempt by Hollister's defense team to have the undercover operation ruled as entrapment, which was dismissed in under 10 minutes by a federal judge who had clearly read the briefs. Warren Fitch received a reduced sentence in exchange for his cooperation. The 2 physicians surrendered their licenses. The billing director took a plea. Raymond Hollister was convicted on 11 counts and sentenced to 19 years. St. Aurelius Medical Center was placed under federal receivership and restructured under new leadership. The community health programs Hollister had built, the ones that were real, the ones that actually helped people, were preserved and expanded with recovered funds. Davia testified at sentencing, which she didn't have to do, and her division chief mildly discouraged, but she did it anyway. She said what she had seen on the floors of that hospital. She said what it looked like when the institution that a community was supposed to trust became a machine for taking from that community. She said it plainly, without performance, and then she sat down. She was back in the office the following Monday. There was already another case on her desk.